This video is the second of the educational series on home health billing. We're going to continue our series with verifying eligibility and also review some background information on the Patient-Driven Groupings Model to help round out the general basics you should know in order to bill Medicare. So let's get started with home health eligibility. In order to be considered eligible for the home health benefit under Medicare, an individual must be entitled to either Medicare Part A or Part B coverage, receive services from a Medicare certified agency, be confined to the home or considered homebound, have a face-to-face encounter with a physician or non-physician practitioner, be under a doctor's care and receiving services under a plan of care established and regularly reviewed by the doctor or allowed practitioner, have a doctor certify the need for intermittent skilled nursing care, physical therapy, speech-language pathology, or continued occupational therapy. There's specific information you need to have available in order to search a patient's records to verify eligibility. You need your home health agency's National Provider Identifier, or NPI, the beneficiary's Medicare number, the beneficiary's first and last name, their date of birth, and the date of service for which you are wanting to verify eligibility. When registering and admitting a patient for care at your home health agency, you first need to verify the patient isn't already receiving services from another home health agency. Utilize whichever system your agency uses to verify Medicare beneficiary information before rendering any care and prior to any billing. Look for information to determine the patient's Medicare coverage. Do they have Part A Medicare? Is it still active? Do they have Part B Medicare? Is it still active? Remember, the patient only needs to be covered by either Part A or Part B Medicare. They do not need both in order to be eligible for home health care. You also need to verify whether the patient is enrolled in a Medicare Advantage plan. If they are, and if it is an Option C plan, you need to send all of the patient's claims to that Medicare Advantage plan. Has the patient elected hospice? Keep in mind, the patient can continue to receive home health services once they've elected hospice. However, any services provided by the home health agency cannot be related to the patient's terminal illness. And any services provided that are not related to the reason the patient is in hospice can be sent to Medicare with a condition code 07 on the claim. Finally, check the MSP information, which is Medicare Secondary Payer. Verify whether Medicare is primary or secondary, and the best way to cover all the MSP bases is to complete an MSP questionnaire. In order to understand what you'll be billing under a home health period of care, it's important to know what drives the billing. A home health patient is certified to receive home health services by their doctor, and that certification is valid for up to 60 days. A physician or allowed practitioner will establish a plan of care for the patient, which will include all of the services that should be provided to the patient for that certification. The home health agency will follow the plan of care to deliver all of the services required to treat the patient. The billing for the certification period is submitted within 2 30-day period of care claims. So there will be 2 claim billings to cover one 60-day certification. If the patient continues to need home health care after that initial certification, the physician or allowed practitioner will have to recertify the patient as eligible for continued home health care and detail the services needed in the subsequent certification. Each certification period is paid under the Patient-Driven Groupings Model, or PDGM. Under PDGM, the way reimbursement is calculated relies on clinical characteristics and other patient information to place each period of care into meaningful payment categories. Just to reiterate, each 60-day certification period is billed in 2 30-day periods. And even though billing is done and payments are made based on 30-day periods, the OASIS, the certification or the recertification, and the plan of care are all based on 60 days. You're essentially billing for two 30-day periods under a 60-day plan of care. And lastly, the reimbursement under PDGM is driven by the home health resource group assigned to the claim. So we're going to look at each resource group in a little more detail. There are 5 main categories for grouping to accurately reflect the patient's needs and reimburse the services provided during each period of care. The admission source category groups the claim based on whether the patient was admitted from an institutional source or community. Under the PDGM, 30-day periods for beneficiaries with an inpatient acute care hospitalization or any post-acute stay in a skilled nursing facility, inpatient rehab facility, long-term care hospital, or an inpatient psychiatric facility within 14 days prior to a home health admission will be designated as an institutional admission. And all other 30-day periods will be designated as community admission. In other words, a community admission is a period of care with no acute or post-acute admission within 14 days of the home health claim's from date. The next category is timing. Timing refers to whether a period of care will be designated as an early or late period. A period is considered early when it is the first 30-day period in a sequence of home health periods. The second and later 30-day periods in a sequence of home health periods are considered late. Periods of care are considered subsequent when there are no more than 60 days between the end of one period and the start of the next period. The third category is clinical grouping. Each 30-day period of care is grouped based on the primary reason for home health care, and this is identified or defined by the principal diagnosis reported on the home health claim. A 30-day period of care can be grouped into one of 12 clinical groups, and these clinical groups characterize the most common reasons for home health care services. A clinical group assignment could change from one payment period to the next. However, the clinical group cannot be changed within a single payment period. Since the principal diagnosis code determines the clinical grouping, if a home health agency reports a principal diagnosis code that does not fall into one of the 12 clinical groups, the claim will be returned for correction. Under PDGM, there are additional payment adjustments associated with other reported diagnoses to capture higher resource use for the patient, and these are reflected in the additional diagnoses that can be reported on the claim. The next category is functional impairment. Each 30-day period of care is grouped into one of 3 levels of functional impairment, low, medium, or high, and these are based on certain OASIS items. The PDGM uses responses to OASIS items associated with functions, including items associated with dressing and walking, to determine the appropriate functional impairment level. And the last category of the home health resource grouping is the comorbidity adjustment. As previously mentioned, the principal diagnosis code reported on the claim determines the PDGM clinical group. The secondary diagnosis codes reported determine whether there are low, high, or no comorbidity adjustments for the claim. Comorbidity adjustments are calculated by the Medicare system when the claim is received and processed for payment based on the diagnoses reported on the final claim, so it's important to make sure that all relevant diagnoses are not only coded appropriately, but present on the final claim submission. This seems like a lot of information to know before starting your billing. However, it's important to understand how the information Medicare requires for billing is used to make accurate payment for the services provided and billed. Thank you for watching this video on verifying eligibility. We covered some background information to help understand what initiates and drives billing services for a home health patient. In our next video, we'll start getting into detailed billing information with the first billing you'll submit for a home health patient. So please continue your educational journey with the video on the notice of admission.